Imagine having to feed your baby anything that may cause them harm. Today, I'm going to share with you about the infant feeding choices of some women with HIV. What do you think the chances of mother to child transmission are with breastfeeding from an HIV mother? Let's consider the challenges associated with formula feeding, the lack of financial means to purchase a formula, the lack of clean water. Um, Prevention of mother to child transmission is the ultimate goal. This can be accomplished by becoming knowledgeable about the potential risk of mother to child transmission from qualified medical staff. That means, if Amy and them tell you what worked for them, that's probably not good advice. Qualified medical staff is important. In February 2012, in a AIDS Care academic journal published by the University of North Carolina, Mammon reported that the mother-to-child transmission is the main source of pediatric HIV infection, and that 17 of the 40 women who were all HIV positive and were interviewed in depth for the study had no prior knowledge that they were HIV positive until this current or previous pregnancy. Well, in the absence of intervention, the probability of mother-to-child transmission is 5 to 10% during urethral, which is when the child is still in the womb, 10 to 15% during childbirth, and then even 5 to 20% during breastfeeding, which means that is the highest risk is through breastfeeding. This can be reduced by as much as 37 to 50% with the administration of antiviral meds, postpartum, of course. However, even with the medicine, the recommendation is breastfeeding, then transitioning to formula feeding after 6 months. Some of the women were unable to adhere to this recommendation because of the lack of milk supply or the mother's poor health, the child's refusal, or even just fear of transmission itself. Now, since we've discussed the recommendation, let's look at the challenges faced to follow them. Social economics play an important role in the infant feeding choices. Whether a woman is married or single plays a choice. Unmarried women don't have the support of a husband, which makes it difficult to be able to purchase formula or even to be able to afford to go to the doctor to receive the medicines you need in order to treat your HIV to help protect your baby. Lack of support and resources. We here in America have the program of WIC. In the the Republic of Congo, where this study was done, there is no WIC program. There is no running water. So these women who are HIV positive have to make the hard decision on whether or not they're going to breastfeed their child knowing that they're HIV positive. But the alternative is to not be able to feed them at all because they can't afford formula. So sometimes breastfeeding with HIV is the only option. Now, as we've learned today, infant feeding choices for women with HIV can be really challenging. But in conclusion, we must know that no mother would intentionally give her child anything that would harm them. But if you have no other choice, you have to give them that breast, even though you know that you're HIV positive, just on the hope. It may be a prayer that God will sustain you. And we've also looked at the recommendations for prevention of mother-to-child transition, and this includes being knowledgeable about your status with HIV, and then how to take the medicines and when the transition from breastfeeding to formula feeding should take place. This should give you some insight into the choices and experiences of mothers with HIV who must make that hard choice to feed knowing that they are infected. Now what we can do is to prevent the chance of mothers to child transmission of HIV by first not having unprotected sex. Thank you for your time today.